All right, so the question came in. So what about my toe fungus, doc? And so I thought we'd do a segment today discussing what I typically do with patients here in the office with regards to their toe fungus. So here's the issue. We already have discussed in another video about nail fungus and laser therapy. Laser therapy, that's separate, and that can augment what I'm going to discuss today. In fact, when we do laser therapy on nails, we absolutely make sure there's a topical as well that's being used. What the question came in though is, what if I just want to do the topical by itself? So here's what we recommend. Unfortunately, topical medications for fungus in the nails are not 100% guaranteed. Even laser therapy cannot get us to 100% guarantee clinical cure rate. The only way to be absolutely 100% guarantee on getting rid of fungus in a nail is to remove the nail permanently, so it doesn't come back. Because even once we remove a nail, there is still a potential for that fungus to come back again. In fact, that's the biggest issue with nail fungus, is a high recurrence rate. And so, yes, there are oral medications that we can take. I really try to avoid prescribing those for patients because they do have side effects. They can interact with other things that patients are taking. The topical medicine that I recommend for nail fungus is this one here. It's called Toenail. Toenail has a foam tip that patients can apply using 1 to 2 times a day is what the recommendation is. And what we recommend doing is, because it takes 6 to 9 months for great toenails to grow all the way out, being consistent with that. I don't even have my patients get this stuff unless they're going to be consistent using it. Again though, to augment the efficacy of Toenail, and we get about a 50% cure rate with Toenail, what we recommend increasing that even higher up to the 60, 70, 70, 80% is using the laser therapy along with that. Because there's such a high recurrence rate, we also recommend using a spray for the shoes. That's how fungus can spread, is through the spores that are in the shoes or on the socks or whatever. And so this is not a spray to use directly on skin contact. It's to be used when you remove your foot from the shoe and you're using that inside the shoe. That the mechanism of that is pretty unique. It attaches to the spores and it prevents the spores from attaching to your foot. Again, spores are the seeds of fungus. That's how the fungus spreads. And so that is our discussion on topicals. There are other topicals that we carry for fungus here in the office, but they're utilized for either the skin or for a nail that maybe has a mild amount of fungus to it. And so if you feel like you're in one of those categories, please come in to Pueblo Ankle and Foot Care. We'd be happy to evaluate that and determine what would be the best for you. Now, one other word that I need to include here is, I see patients come in frequently that they're the kind of patient that paints their nails and then removes the nail polish and then immediately reapplies. Now, standard nail polishes have things like toluene, formaldehyde, PABA. So those types of ingredients in the nail polish are meant to help to preserve the polish and help it last longer. Unfortunately though, when you're reapplying, right immediately after, you're trapping in fungus, and you can also cause discoloration of the nail as well, not just having the fungus develop. You can just discolor them and cause them to yellow anyway. So I recommend giving yourself a break, giving up to a couple weeks. Now, everybody's nails are different, so you'd want to determine, hey, is this discoloration going away? We also have a nail conditioner that we carry here in our office that you can apply to your standard nail polish, and that can help prevent that type of an issue with the toluenes and the formaldehyde, the PABAs, causing that type of issue with your nails. That is our discussion about topicals for nails. There are nail polishes, by the way, that are out there that you can use that don't have those types of ingredients, those harmful ingredients that I mentioned before in them. We even carry one also here in our office for our patients' convenience. But I hope this was helpful. Turn on your notifications for YouTube. We'd love to have you know exactly when we're putting out these new videos so that you can have them in your ready box to watch.